The future of community pharmacy, what does it look like to you?
Well, I'd say it has never looked brighter.
Good.
So
Good start.
One of the things that pharmacists have tried to do for years is break down the barriers to do more. And while we've been doing that over 30 years now, the need in the community has also been increasing. And it's at our health system's at breaking point, and we're just ready to go. And I think the juxtapoint between the two is happening before our eyes, and it's about to
pop off.
It'll be a tipping point, I think, over the next year and the years ahead.
Kim, what about you? What do you think the...
Yeah, no, I would agree. It's sort of, I think there's a huge opportunities for the profession to be, to grow. And I also think that as David mentioned, is that you can see at community pharmacy that people don't have access to doctors. They don't have that access to other health professionals now. And I think that's where pharmacy can really fill that need, is that we are accessible, and as we build our scope, there's more things that we can add value to. So, and I think that the governments around Australia now are sort of seeing the role of pharmacy, especially during COVID, where pharmacists sort of stepped up and did a lot more. And I think that there's a sort of a general excitement, because I think our peak bodies are also aligning to have this vision of pharmacists doing more and being better pharmacists. So I think David said it's very exciting, especially for the young pharmacists coming through, and even older pharmacists who want to go back and upskill, that it's not Groundhog Day of all I'm doing is dispensing medicines. There is an opportunity to be more proactive in helping the patients, and not sort of just limited to dispensing the medicine.
David, what do you think of what Kim said?
I perfectly agree, and I think the other thing it brings to pharmacy is playing into the heart and soul of what we want to do, which is help people. And there's nothing worse than being in a situation where you know you can help but you're not allowed to. So I think it's actually opening up now, so we'll be able to do more good work, and the whole profession will get a lot more fulfilment out of what they do on a daily basis.
Prescribing pharmacist is what you'll be looking at. Tell us a little bit about that.
So prescribing pharmacist isn't all about prescribing. It's about listening to a patient differently. So we'll be able to go into a consultation and actually listen to the patient and learn about them and document and take histories and go on their journey. And it may not even be writing prescription, it can be advice or referrals. So we're just linking up to other health professionals, and if needed, it'd be so great if someone came in after hours or on weekends from the emergency department down the road, and I'll be able to offer them some help rather than saying you'll have to go back to the emergency department for 6 hours. And so that's what it is. It's a collaboration with other health professionals and hospitals to just extend our skills and work together.
Scope of practice. Yes. How will pharmacy change with this?
It's going to be amazing. I'm really looking forward to seeing where it goes. It's going to open up lots of doors for new pharmacists. So we'll be able to employ more pharmacists, more staff, to be able to manage those services. And it's going to be very clinical. So a lot of pharmacists who've obviously tried to go that hospital route will see that the community practice is as clinical as hospital can be.
One of the big things, scope of practice, how do you see that improving patients' lives?
So by becoming embedded in a patient's healthcare journey and having touch points with them at regular intervals, we do that now with prescriptions, but we're going deeper. We're now going to be actually monitoring and suggesting changes that are actually going to improve their healthcare outcomes. So scope of practice is going to allow us to do the what we'd like to think of as the easy stuff, but those acute occasions of service where somebody comes in with an illness, we know perfectly well what it is and how to treat it, but we've had to refer them onto a GP, which has always been a very difficult thing to get timely access to a GP for something which is an acute illness that requires immediate treatment. So we're going to be able to treat those things, which is going to be much better for patients.
How much more convenient?
Absolutely, and things are going to be treated in a more timely manner. But in terms of chronic disease, there's a real emerging body of evidence now that shows that when you actually get a pharmacist involved in chronic disease and how that is managed going forward, that you get much better control of that illness and much better health outcomes and quality of life. So I think it has the potential to actually make a massive difference to healthcare in Australia.